Having a child is a natural process, but for women older than 40, the risks associated with pregnancy increase, risks for the mother and the child. But there are ways for women to deal with those concerns. Lorene Cachola takes a look in this edition of Her Baptist.
Satvinder Rana and Manju Maturi hadn't expected to make this visit to the doctor at this point in their lives. Maturi is checking in with her OB/GYN. The couple has been married for 13 years and has a 12-year-old son. The fact that their son has a new brother on the way was a complete surprise.
We always thought we'd have another baby, at some point, but just being so busy with doing this and doing that, and then we moved from India to this place, and we've just been very busy, so we never thought of, really planning a second baby. And then we said, okay, one is good, we're not going to have another one. But it just happened.
According to doctors, many couples in their 20s and 30s are delaying having children for various reasons, including career, education, even getting married later in life. For some couples, the challenge of having a baby after 40 can depend on science, including using in vitro fertilization to conceive. That's because the changes in women's bodies as they get older can make traditional conception difficult.
What should naturally happen as a healthy patient becomes pregnant and goes through the pregnancy is their blood pressure should naturally drop a little bit, and their heart works harder to supply the baby with nutrition and oxygen and blood flow through the uterus. What happens with aging is exactly the opposite.
Pregnancy past 40 comes with additional risks for mother and child. Older moms face a higher risk of dying during pregnancy or delivery. Babies have a higher chance of genetic problems, including Down syndrome. Children born to older women also risk non-genetic problems such as heart defects. Moms can also develop pancreas problems, leading to gestational diabetes, another reason why it's recommended doctors keep a close watch on older mothers-to-be.
I think the most important thing is to identify any medical problems on the front end. And so we offer our patients a preconceptual counseling visit where we can do a thorough exam. We can look through their history and even their family history. We can perform appropriate tests like to look for diabetes, be checking their blood pressure before pregnancy to identify any health concerns that might develop problems during pregnancy.
A healthy lifestyle helps. Smoking increases the risk of blood pressure problems. Being overweight can increase the chance of giving birth by cesarean or C-section. And any surgery in an older patient has more risk of trouble with blood clots or infection after delivery.
I am very comfortable. We saw the baby on ultrasound. We saw basically lots of things. All his digits are fine. And, we looked at the heart, we looked at the aorta, and the kidneys and everything. And then I was pretty convinced that the baby's fine.
So for women wanting to be moms later in life, it's smart to be healthy on the front end. It reduces but doesn't eliminate the risks. And women in their 40s wanting children should plan on keeping in close contact with their doctors. That way, managing a planned or unplanned pregnancy can be a little easier. For Smart Medicine, I'm Lorene Cachola.